everyone for coming today. We are here to talk about COVID-19 and respiratory illnesses to provide you with information from leading experts across the city. We will be hearing today from our partners at the Philadelphia Department of Public Health, Dr. Shara Epstein, who is at the Division of Disease Control, and also we will be hearing today from Dana Perella, also the Division of Disease Control at the Philadelphia Department of Public Health. They will be speaking about the two of the viruses that are currently circulating in Philadelphia and also in the United States. The RSV, respiratory syncytial virus, which causes the common cold, and also the flu. Thank you so much, Dr. Epstein and Dr. Perella, for joining. Next slide.
Thank you, everyone. So just a little bit about activity in the United States, as you may have experienced for yourself and also have seen and heard on the news that we are having a really active return of cold and flu season in the US, and it's starting earlier, and we're seeing larger numbers than we have in the past. So this slide shows, and I'm not sure if the full slide is getting cut off. There should be two figures on this slide, but this slide does show RSV activity in the United States. So we'll start with the first part. It shows RSV activity in the United States, and the two, the purple and the blue lines, just show the number of RSV positive reports to the CDC. And you can see on the far right side of the figure that activity really started increasing, and I know it's hard to see the dates, but from October of this year forward, we had a sharp spike and increase in RSV activity nationwide. Next slide. Similarly, with flu activity in the US, we're seeing high to very high activity levels, as shown by this map, in nearly all states in our country. So again, this is a lot earlier than we've seen in the past, with higher numbers of cases than we've seen at this time of year. Next slide. This next slide shows what's happening with influenza in the city of Philadelphia. And the dark blue line shows us what's happening for this season. And as you can see, we've had this really sharp increase in recent weeks, and it's continuing to trend upward. And it's much higher than we've seen in the past 3 seasons. Again, earlier increase, we typically see increases in flu in January and February. We're seeing it much earlier this year. And much higher numbers. Again, very similar to what's being seen nationwide. Next slide. And this next slide shows what has happened with RSV in the city. We had a sharp rise, as we saw with the nationwide data, starting in October. But we can now see with the red line that disease is starting to trend downward, although we still have a higher number of cases than we've seen in the past through a couple of years. Next slide. And I'm going to hand things over to Shara to talk a little bit about current COVID activity.
Thank you, Dana. So while we are seeing flu and RSV in large numbers for the first time in a couple of years, we still have COVID. Luckily, we're not seeing it kind of at the numbers that we had seen in the past couple of years, but it is still here, and it is still causing people to be sick. Philadelphia is currently at medium community levels as designated by the CDC. Next slide. I wanted to mention the COVID booster, the COVID booster dose that is new since September and is now available for all children. And a lot of people think, why do we need more shots, more boosters? And some scientists did a study to look at what they predict would happen if most people, if 80% of the people receive the new booster, the booster that's made for both the kind of old COVID and the Omicron strain. And the scientists that did the study predicted that if 80% of people, adults, kids, everyone, receive their COVID booster, we could prevent almost 51,000 children, 51,000 hospitalizations of children. So almost 700 busloads of children in the coming months before the end of spring, and prevent almost 11,000 ICU stays, intensive unit stays. So almost 150 busloads of children between now and spring, if a lot more people get this bivalent booster. So there is still, it is still very important to get your updated COVID shots. Next slide. This slide is a little bit busy, but I wanted to show this because again, this is a important study that scientists did to look at what the COVID booster will help us with, because you may be thinking everyone I know who got the COVID vaccine has still gotten sick, has still tested positive for COVID. And that's true. And the vaccine, unfortunately, it's not preventing every single case of COVID anymore. Many people who have gotten the COVID vaccine still get COVID. But the really important thing is that very last line at the bottom, which says mortality, and that means death. And you can see, even though people are still getting COVID, testing positive for COVID after they receive their vaccine, the COVID vaccine is still preventing death really well. So it's still preventing the biggest, hospitalizations and people dying from COVID. Next slide. So we're seeing a lot of different viruses this fall, and it can be hard to tell them apart. And I'll talk about this slide, but really, kids are kids, and everyone reacts differently. So these symptoms, these kind of ways to tell you're sick, people can get them from any of the viruses. And really the only way to tell what virus you have is by testing. But often the flu virus causes fever, loss of appetite, a sore throat, and sneezing. Colds or respiratory syncytial virus often causes sneezing. The COVID virus used to cause loss of taste and smell, although we don't hear about that as much anymore. So you might hear people talk about different ways to tell these viruses apart, but really the only way to tell is to get tested. Next slide. Most kids don't need to, be seen by their doctor for every cold they have. But there are certain things that you should definitely call your doctor for to see if your child needs to be brought in, or even sometimes if they're having trouble breathing, go to the emergency department. Things like breathing very quickly, not being able to eat, or not peeing, very high fevers. You should call your doctor, and your doctor will tell you if you need to bring your child in to be seen. Next slide.
So now we're going to move on to talk about some measures to help prevent the spread of cold and flu, as well as COVID. So the first thing is knowing when folks should be staying home. And so students and staff, when you're feeling sick, should stay home. The timeframes may vary based off whether or not someone has COVID. But if someone does test positive for COVID, we are still following the COVID guidance, which is staying home for 5 days from onset or the date of the positive test if someone does not have symptoms. If the individual is fever-free without medication and symptoms are improving, the student or staffer may return. However, from day 6 to 10, the individual returning, whether it's a student or staffer, should be wearing and adhering to wearing a high quality mask and wearing that mask appropriately, so covering the nose and mouth. The time frame for staying at home may be longer in someone who's more severely ill, so someone who is hospitalized, or in students or staff who may have conditions that affect their immune system and just make them more prone to shed the virus longer. And then for flu and other non-COVID colds, other viruses like RSV, the student or staffer should stay home until they're fever-free without medication for at least 24 hours. They should also not have vomiting or diarrhea for at least 24 hours without medication. Additionally, those who have difficulty breathing, any behavior changes in children, children who are unable to take part in routine activities or having excessive cough or excessive runny nose should also stay home. And when testing for COVID is not done, the COVID guidance for staying home, so staying home for at least 5 days, should be followed at a minimum. Next slide. The other tip, which Shara had talked a little bit about COVID vaccine, is making sure both students or staff are getting vaccinated for both flu and COVID vaccine. And these, the vaccine, seasonal vaccine for flu and the booster dose for COVID-19 can be given at the same time. And so seasonal flu vaccine is recommended for persons 6 months and older. And so COVID-19 vaccine, that's just changed within the past few days, but now persons 6 months and older are eligible for bivalent boosters. It depends on the from 6 months to 4 years of age or 5 years of age. It's going to depend on the product the child received and how many doses the child received, whether or not they need a bivalent dose. So talk to your child's pediatrician or clinic that they see regularly about the booster dose. And then for those who haven't been vaccinated, the initial vaccine doses can be given to those 6 months and older, and it's not too late to get started on that COVID vaccine. And we have some resources on where to get vaccinated in Philadelphia. The City of Philadelphia Department of Public Health does have walk-in clinic hours for flu vaccine as well as COVID vaccine at our health centers. The links are included here. We also have federally qualified health centers in the city that are able to help with assisting getting folks who may not have a provider or may not have insurance vaccinated. For those who do have insurance, they may consider going to pharmacies to get family members who are 3 years and older vaccinated, or see their regular healthcare provider for vaccination. Next slide. And just some other reminders to prevent colds and flus. And I know folks have been doing this for almost 3 years now because these overlap with COVID precautions, but you want to avoid close contact with persons who are sick.
I'm
Oh,
sorry.
I think one of the interpreter lines is open on our line.
Okay.
Folks want to wash their hands often. They want to cover coughs and sneezes, clean and disinfect those surfaces that are high touch. Also, folks can consider masking when indoors and on public transit, particularly now when we're seeing lots of different viruses circulating at high levels. You want to encourage your children to not touch their face with unwashed hands,
Hello?
staying home when you're sick, And also making sure that anyone who is sick drinks plenty of fluids to make sure that we can try to prevent dehydration by having encouraging fluid intake for anyone who is sick. Next slide. And Cher, I don't know if you want to take the routine vaccination slide.
We're not talking about other, we're mostly talking about things like RSV, flu, and COVID today, but I did want to just mention that during the pandemic, many people weren't able to get to their pediatricians to get their regular vaccines for their kids. There was so many people sick, and for a long time we told people to stay home. And it's really important that all those kids catch up on their vaccines. And I know the pediatricians are doing a lot of work to make sure that happens. There's right now a measles outbreak in Columbus, Ohio. Last week when I made the slide, there were 63 cases. Now there's more than 70 cases of measles among children in Columbus. And a lot of them, at that time, it was 25 children had been hospitalized. And almost none of the children have been vaccinated for measles. So I just wanted to remind everyone to make sure that their children and the children in their schools are vaccinated against the normal things that children have gotten vaccinated for years, like measles and, of course, polio. You've heard about recent polio cases in New York. Luckily, we haven't seen any measles or polio here in the United States. Here in Philadelphia. But we want to keep it that way. So again, just a reminder to make sure all those vaccines are up to date. Thank you.
And we're just going to end with some resources for folks. The health department's calendar for COVID vaccination clinics and free at-home test events where their at-home test kits are distributed are available at the web link posted. Also, stay connected with the health department to follow what's happening with trends with these cold viruses and flu and COVID by following us on Instagram or Twitter or our Facebook page. And then also we've just left some other general websites that have good information on all types of infections, from flu to COVID to other respiratory viruses like RSV.
Thank you so much, Dr. Epstein, and also Dana Perella. I'm very appreciative of you coming from PDPH to talk. There are a number of questions in the chat, which we will get to at the end. We will definitely get to your questions, some great ones that are coming up. I wanted to mention that these slides will be available, and the recording will be available as well on the Student Health Services website. So next slide. Great. Now I want to introduce Dr. Katie Lockwood. She's the Distinguished Chair of Pediatrics and also a primary care pediatrician at CHOP. Dr. Lockwood will be speaking today about how to navigate this sick season where we have RSV, we have flu, we have COVID. What should we be doing as families, as parents, and also as staff to make sure that students and our families as well remain safe? So thank you, Dr. Lockwood.
Thank you. Thanks for having me. I'm a distinguished chair in pediatrics, but I'm not the chair of pediatrics, but thank you. You can go to the next slide. So CHOP has put together a website called Navigating the Sick Season, and a lot of what I'm going to talk to you about is also there. Whenever possible, I've put a QR code in the corner for you to go right to the site of whatever I'm talking about at that moment. So each QR code will link to the resources, and this one links to the Navigating Sick Season site where everything is collated for you. You can go to the next slide. So As the health department mentioned, it's very hard to distinguish between common colds, flu, and COVID. It's, I think, the hardest to distinguish what COVID is because it looks so different in each child. So in some kids, it can look very similar to a mild cold or seasonal allergies, and other kids look much sicker from COVID. And so it's really, really hard, even for us as physicians, to distinguish based on symptoms what's COVID and what's not. And so doing a COVID test is really the best. In terms of flu, though, which we're seeing a lot of right now, as the health department said, the classic story that I hear is a kid who was fine yesterday or went to school fine, and then it sort of hit them like really hard and fast. So unlike a cold, which sometimes simmers for a little while with like a runny nose and maybe a little bit of congestion and seems to get worse, the flu kind of comes all at once and comes hard and fast. Next slide. So let's talk about the flu. As I said, it comes on suddenly. You're most contagious in the first 4 days of illness. And again, you have many symptoms. So kids tend to not just have one or two things, but they kind of have everything. They have the cough, congestion, headache, fatigue. Everything is achy. They may have vomiting or diarrhea, sore throat, and fever. And most kids will do fine with the flu. And most kids do not end up going to see the doctor or going to the hospital, but some kids are higher risk. And that is particularly kids under the age of 2 or who have asthma or other chronic diseases, particularly things where their immune system may be weakened. Next slide. And the health department just talked a little bit about COVID, so I won't go into this too much. But again, those first 5 days are when you want to be isolating at home. Day 0, when you're counting days, is your first day of symptoms. And this slide just goes through some of our CHOP protocols in terms of isolation. But I'll let you look at that resource later, and we can go to the next slide. So another resource that CHOP put together is this symptom checker, which can be a great way for you to look up the symptoms that your child has and try to get some resources about it, learn maybe what's going on and whether or not your child needs to be seen for those symptoms. It's in English and Spanish, and you put in their age and their gender, and then it will pull up a graphic of their body where you can click on different body parts or you can type in different symptoms, and it has many resources linked there related to the symptoms that your child is having. Next slide. So fever is one of the symptoms that I get asked about the most. And the thing that I want to convey to you is that fever is our friend. So fever is your body's natural way of fighting infection. And so it turns up the thermostat to try to kill the germs that are there. We see high fevers in kids all the time, much higher than what you see in adults often. And fever does not mean, it doesn't tell you what the diagnosis is, because you can get a fever from a virus, from a bacterial infection, or many other things as well. I get worried about fever when it's been there for more than 3 days, or if there's a fever with no other symptoms, so no cold symptoms and just a fever, then I wonder where that fever is coming from. Certainly a fever associated with a seizure, or if their child looks unwell. So I tell parents not to look so much at the number on the thermometer, but to look at how their child is acting. If the fever is high and your child looks well and they're eating and drinking still, and you give them some Tylenol or Motrin and they feel better, then I'm not worried about that temperature, no matter how high it really was. But if the temperature is even on the lower side of a fever and your child is sluggish or lethargic or is not eating and drinking and getting dehydrated, then I'm more worried about that fever. So really what's most important is how your child looks. And again, there's this QR code will take you to this fever video that CHOP has that I really love. And on the symptom checker, we also have dosing guidelines for all different forms of Tylenol and ibuprofen. Acetaminophen and ibuprofen are both having some shortages in pharmacies. So if you're having trouble finding the one that you usually use, you may need a different form. And so our dosing guides can help make sure that you're in the right dose range. And if you have any questions, it's really important that you talk to your pediatrician about the proper dosing, because you can overdose on both Tylenol and Motrin. So be careful. Next slide. Cough is a normal part of a respiratory infection. And so while the inclination is that you want to stop the cough by suppressing it, we don't recommend over-the-counter medications that stop the cough. We want the body to bring that mucus up and out of the lungs. And coughs can last for a long time. So often your child will be sick with their cold or flu or COVID or whatever they had initially, and then that cough will linger for about 7 to 14 days afterwards. Over that time period, it should be getting less severe and less frequent and tapering off, but it may be there for quite a while. It can be very pesky. Some things you can do, I love steaming up the bathroom. Just run the hot water and have your kid hang out in the bathroom breathing in the steam, or using a cool mist humidifier in their bedroom while they're sleeping. You can also melt some honey in a warm apple juice, cider, or tea, and hydration in general is going to be most important. Again, like the health department said, if they're breathing harder or faster, using their chest muscles, flaring their nostrils, or grunting, those would all be things that I'd worry about related to their cough. Next slide. Vomiting and diarrhea are also common this time of year. We're seeing a lot of GI viruses circulating, but as well, you can get these symptoms from the flu and sometimes from COVID. Vomiting typically is shorter, lasting for 24 to maybe 48 hours, but the diarrhea piece can last even longer. The most important thing with these symptoms is hydration. So small, frequent sips of fluids, whatever your child wants to drink is fine with me, but usually things that have some electrolytes like Gatorade or some juice are a little bit better. And then slowly ramp up their diet. So starting with something bland like crackers or rice or just dry foods, and then gradually as their appetite is coming back and they're holding things down, you can start to put in their normal foods again. Probiotics might help here. They're available over the counter as well, or in foods like yogurt or anything that's been fermented, like kimchi, pickles, and sauerkraut. Next slide. Antibiotics do not treat viruses. We consider antibiotics for things like strep throat, or we might want to think about antibiotics if there's a new fever that comes a few days into an illness, like later in the illness, fever and ear pain in particular, or urinary symptoms. So if any of those, give your pediatrician a call. There are a lot of antibiotic shortages right now, so your pediatrician is going to be judicious in their use of antibiotics and reserve them just for the kids who need them. They're not going to help with viruses. Next slide. So where to seek care, this is really important because everywhere is very busy with the high sick volume. So you want to go to the right place at the right time. Your first stop is most often going to be your primary care pediatrician. We can handle most childhood illnesses, coughs, cold, flu, headache, and all different types of aches and pains. After hours, though, if you feel like your child needs to be seen for something more urgently, like a high fever or asthma issues or urinary tract infection or any kind of minor first aid or burns, you'll want to go to an urgent care. If something is more serious and urgent, so respiratory distress, like having trouble breathing, severe dehydration where they might need IV fluids, and certainly anything like an allergic reaction or trauma, then they should go to an emergency department. Next slide. I would say, actually, if you're going to an emergency department and your child's condition is not severe and it's a minor illness, the wait times right now are quite long. You're going to be there for probably around 6 to 8 hours. And so really try to avoid the emergency room if you don't need it. Call your pediatrician and see if it's something that can wait. Now at home, you might want to stock a few things in your medicine cabinet during this season. So pain relievers like acetaminophen or ibuprofen. Again, there are shortages of these around, so don't buy more than you need. Antihistamines can be helpful if your child gets an itchy rash, which sometimes happens with viruses, but can also happen from allergic reactions for other reasons. So things like cetirizine or Zyrtec or diphenhydramine or Benadryl. And then nasal saline drops for little ones or spray can be helpful to break up some of the mucus in their nose. Having cleaning supplies, fluids for kids to drink, and making sure you have enough of their routine medications and that you don't wait till the last minute for refills, so that you have things like their EpiPen or inhaler available. And make sure you post that poison control number somewhere in your house, so that if someone gets into medications or you give the wrong dose, you can call them and ask for help. Next slide. When to return to school, we talked about this a little bit, but it's a really important point. So fever-free for 24 hours without any medications. Symptoms should be improving and nearing back to their baseline. And I really feel that they should be able to eat and drink on their own without someone nagging them, right? We want to make sure they go to their school lunch and they hydrate and eat, and that they have enough energy to maintain focus for learning. So you don't want to be like this little girl and sleeping on your books during the day. Next slide. So what you can do, we talked about this already, vaccinate and catching up on routine vaccines, getting your flu vaccine and COVID. So it is still early enough in the season that you can get your flu shot. This is the question I get asked the most often. It's definitely time to get it, and getting it right now will give you a chance to build immunity before the holidays, which is great. Next slide. Also, teach your kids. So because there's so many germs out there right now, if your kids are currently healthy and you're worried about how to stay healthy, teach them not to share drinks or food with anyone. So at lunch, kind of keeping their hands to themselves and not sampling other people's food. Try to cough or sneeze into their elbow. So we call this like the cough pocket, not into their hands, because then they're touching everything else and everyone else with those germs. And washing their hands often. So my kids and I, we try to get in the habit, as soon as they get in the car, we use some hand sanitizer. As soon as we get home, we wash our hands, and building that routine will help your kids keep their hands clean and prevent them spreading germs when they're touching everything. Next slide. This is also a time to stay home when you feel sick. It's really important. As I mentioned, there are certain populations who are extremely high risk for what in other people might be a minor cold. So you really want to avoid spreading those germs. And if you are sick, keep yourself or your child home. Next slide. And this is the last one. So with holiday gatherings and travel coming up, again, stay home if you're sick. Be open with your guests about that policy that you would stay home if you were them. Test for COVID. You might want to test before you gather with your loved ones, and testing afterwards is a good idea as well, to make sure that you didn't pick up COVID while you were traveling. Again, wash your hands frequently. Increasing ventilation at home or gathering outside can help. Wearing masks at large gatherings in public places. So things like grocery stores, airplanes, or concerts that you might be attending over the holidays, wearing a mask can be an extra layer of protection for you. And again, get vaccinated. And I'll turn it back over to Dr. McDowell. Thank you so much. Though there's our Navigating Sick Season link too. If you missed it, you can also just Google CHOP Navigating Sick Season and it will come up, and all of those resources are there. Thank you.
Thank you. Next slide. Great. So just wanted to kind of reiterate our goals this year. They're really to keep students healthy and safe in school. This is one of the reasons why we want to bring this information to parents, to keep schools open and students learning in person, and also minimize disruption to school operations. We're also working to identify outbreaks of COVID-19 quickly and implement public health measures and reduce any spread of COVID in the school. Next slide. Next slide. Perfect. So as mentioned, this year we do have testing available. Our 5 mobile testing sites, and I'll drop the link into the chat, are available for students, staff, and family. Starting December 12th, we have free over-the-counter test kits that are available for students, staff, and family, as well as community as supplies last. So highly encourage students and staff to take advantage of the free testing that's available through the school district. Definitely testing in school is also available through a school nurse if there's the consent on file. As mentioned, as Dr. Lockwood has mentioned, PDPH has mentioned as well, Supporting vaccination, so encouraging all students and staff to be up to date on their COVID vaccinations, including the boosters. Their bivalent boosters are also available for children currently. Next slide. Ventilation remains a priority. Social distancing as well continues to be recommended when feasible, and also cleaning and disinfection. So enhanced cleaning and disinfection continues to take place as part of our layered mitigation measures, with the focus on high touch areas and also routine cleaning and disinfection that happens every day throughout the school day. We're encouraging parents, staff, students to practice proper hand hygiene, washing their hands with soap and water, and also continuing to use alcohol-based hand sanitizer. These things are not only going to prevent COVID, but also RSV spread, other respiratory disease spread as well. And hand sanitizer and cleaning products are available for students and cleaning products are available for staff. Next slide. So our masking guidance, as you all know, we mask the first 10 days of the school year, and we'll be requiring masking when the COVID-19 community level is high. Currently, the community level is medium, and masking is strongly recommended in schools. Under specific instances, we will recommend universal masking, universal masking. So if there's an outbreak in a classroom, that classroom will need to mask. If there's a school-wide outbreak as well, that entire school will need to mask. And as mentioned earlier in the year, upon return from extended breaks and holidays, such as winter recess, when we see increased social gatherings may heighten the risk of exposure to COVID-19. Next slide. So, we recommend that masks are worn, strongly encourage masks are worn properly, and masks are provided to students that do not have proper masks. The recommendation really is to wear a high quality, well-fitting mask. You can double mask with a surgical mask and a cloth mask on top, a KN95 and N95 as well. There are accommodations available if there is a medical condition, a mental health condition, or other condition that prevents a student from masking. So those accommodations are available. Next slide. We mentioned the CDC community levels. We are following the CDC's recommendation and also PDPH's recommendation as well. So currently we are at medium community level, so we are strongly recommending masking. With high community level, the recommendation is that everyone mask indoors. Next slide. The CDC's community level is publicly available. You can go onto the website and pull down Philadelphia County in Pennsylvania and see the data for the county. This data allows us to determine what communities and individuals should be doing to prevent the spread of COVID-19 in their families and also in their communities. The levels are determined by the number of new COVID-19 cases, the number of new COVID-19 admissions, and the percent of inpatient beds, so hospital beds that are occupied by COVID patients. As we know, these levels, the number of new COVID cases, is really dependent upon people getting a PCR test and it being reported up to CDC. With the amount of individuals that are using over-the-counter test kits, which is great, we want to continue to use that. We do know that there's potentially some underreporting of the total number of COVID cases that are in our community. Next slide. Okay. So currently we have been implementing Mask to Stay. We want to keep kids in school to have in-person learning. That is really our priority. And so when a student or staff is exposed to someone with COVID-19, regardless of their vaccination status, they're required to mask for 10 days. So this is this, instead of having to leave school, they can stay in school and they can mask for 10 days. As mentioned, accommodations are available for students who are unable to mask due to a medical condition, disability, or mental health condition. Next slide. So for those students who test positive, so students who test positive can isolate at home for at least 5 days, again, if they are COVID positive. And there is the opportunity to participate in virtual learning when they are isolating at home for that 5-day period. We recommend that if a student tests positive, that their parents or guardian notify the school nurse, or they can call the COVID response team, so that we can make sure that we can capture that information and that the school is getting that information, and that students that were exposed and staff that were exposed as well will be able to mask. The recommendation is when those students return back to school on day 6 of illness, that they wear, again, a high quality, well-fitting mask for the additional 5 days. So from day 6 to day 10. There was a question in the chat around, students that are coming back on day 6 through day 10 in terms of eating. So what can we do, because they have to take the mask down. So our schools are equipped to deal with this. And some schools are providing social distance area where that student can eat in the lunchrooms. Others might provide another area where students are designated for students that have returned to school and were recently tested positive for COVID-19. So those are activities that are taking place at the school level to reduce any type of spread if there is still some infectious virus that the student is shedding. But again, we want to make sure that our students are in school, they're learning, and this guidance does align with the CDC's guidance. Next slide. So COVID symptoms, recommendation, if there are any new symptoms not explained by a prior medical condition, that could be a fever, muscle aches, headaches, sore throat, congestion. These are things that you would want to be attuned to say, hey, my child might be sick. Let me get them tested for COVID, or let me get them to follow up with their primary care doctor as needed, taking into account what Dr. Lockwood mentioned. And we recommend that, if a student feels sick before the beginning of any school day, please keep them home. That is the best way to help prevent the spread of viruses in the school. Next slide. So what happens when a student tests positive? The parent or guardian can notify the school nurse, and then the school nurse or a designee will then notify the COVID response team, and we will work with the staff, we'll work with parents, we'll work with the students, the school in particular, to put in those mitigation measures. And then also we work with PDPH as well around this. Next slide. So when can you return? So when you test and you're determined to be COVID-19 positive, the student will need to remain home until all of the following are true. They don't have any symptoms for 5 days of isolation, and then they can return on day 6 through day 10 wearing that high quality mask and eating in a designated area. They also must be fever-free without use of using any fever reducing medication like Tylenol or Motrin. Next slide. So what to do if a student has symptoms, right? Has symptoms of a viral illness, but is COVID negative. We recommend that they can remain home until they meet any of the school's normal criteria for returning. So fever-free, no vomiting, no diarrhea, at least within the past 24 hours without the use of medication, or they have a doctor's note saying that there is an alternative diagnosis. Next slide. So this is, if a student has symptoms, but no COVID test is done. So for some reason, there's no COVID test done, and we do not know if the child has COVID or not. So when symptomatic, but COVID-19 testing was not completed, the student can remain home until the following are true. They are symptom-free for 5 days of isolation. And they have to isolate for that 5-day period, and they may return to school, but need to wear that high quality mask as well for the additional 5 days, and eating in a designated area. And they are fever-free for 24 hours. Or they have a clinician note saying that there's an alternative diagnosis or reason why they had symptoms, and they can return to school based upon that. Next slide. So this is just saying, getting back to the basics. We have shared all this information with our schools. So hopefully you will see this poster up in schools to remind how we can get back to the basics of preventing spread of respiratory illnesses. So avoiding contact with individuals that are sick, washing our hands, avoiding touching our faces with our hands, cleaning and disinfecting, staying home when sick, and also covering our cough. Next slide. So just a reminder about our sick policy. If students are sick, they should remain home. And the student can return to school once they meet our normal return to school criteria, as long as it's, of course, not COVID, and then they need to isolate for that 5 days. If they are non-COVID, they are feeling okay, they can return to school fever-free, no vomiting or diarrhea for greater than 24 hours without the use of medication. Next slide. So preparing for winter break. So as mentioned, this is the month of December. We are providing free over-the-counter test kits for students, for families at the 5 test locations. Schools also gave out test kits a little bit before the Thanksgiving break, and some continue to do it after the Thanksgiving break as well. These are the locations where you can pick up the test kits. These locations will be closed January 2nd and December 26th for the holiday, observance of the holiday. Next slide. So things to keep in mind as we prepare to break for winter. Winter break. Test if exposed to someone with COVID-19. If you're experiencing COVID-19 symptoms before or after large gatherings, and also prior to returning to school. We really appreciate that. So you can determine if your child has COVID, they can isolate for 5 days, and we can reduce the amount exposure that students and staff are having to COVID-19. Getting that flu vaccine, that COVID vaccine, and the booster, masking when you travel or in indoor crowded spaces, washing hands with soap and water, and staying home if sick and getting tested. Next slide. So returning from winter break, as mentioned, at the beginning of the school year, we noted that we may require masking for 2 weeks after return from extended breaks. This, as mentioned, is winter break is upon us, and we are in a situation where COVID is increasing. We've also seen RSV and flu, and we are following PDPH's guidance, and we'll be masking for our students, ideally for January 4th through January 13th. More information will be coming out about this. As mentioned, for students that are unable to mask, accommodations are available. We recommend using a well-fitting, high-quality mask. And this is a proactive measure to reduce the spread of COVID-19 in schools and reduce missed school days after winter break. Next slide. And here are some resources available. I know we are running over because we started a little late, but I did want to open it up to, next slide, questions. Great. So this question is from Ms. Ackert. Ms. Ackert asked this is for Dana and also for Dr. Epstein. Regarding the reference for the 51,000 hospitalizations prevented, if we have 80% of individuals boosted, if you could provide that reference, you can put it in the chat or send it to me. We can get that reference out to Ms. Ackert. That would be great. Additionally, either Dana or Dr. Epstein, can you clarify the efficacy of the primary vaccines and then the efficacy of, or the effectiveness of the booster for COVID?
Sure. So yeah, I saw a question about saying that the vaccine didn't work, but also it did work. And I wanted to clarify, because we are seeing infections in people who got vaccine, and you know, we don't want to pretend that we're not. We've all experienced it at this point, but the vaccine still is doing a really great job at preventing the really severe cases, the hospitalizations, and death from COVID. So it's early yet. We don't have effectiveness numbers yet for how much that's going to prevent, but it has been all along preventing severe disease and death. Yeah.
Thank you for clarifying that about the vaccine primary and also the bivalent booster. I see another question around, okay. There was a question around myocarditis. Can you, Dr. Epstein, Dana, or even Dr. Lockwood, talk about the risk of myocarditis, who we're seeing that risk in, and particularly with, you know, in what vaccine as well?
Sure. Or Dr. Lockwood, do you want? I can start, and Dr. Lockwood can jump in if she wants. We did see a very low risk of myocarditis, and that's inflammation of the muscles around the heart in kind of adolescent boys, so older teenage and young men. And that was we saw it most with the primary series after the second dose of that primary series. So there are now recommendations from the CDC and the FDA that you can space apart that primary series. It used to be 3 or 4 weeks, and recommendations now to space that up to 8 weeks to avoid that risk. We really haven't seen it at any significant numbers, I don't think, with the booster doses. And you know, we're getting booster doses so much later than the primary series. So we really don't seem to see that risk anymore.
And I would add that the risk of myocarditis from natural COVID infection is significantly higher than the risk from the vaccine. So most of the cases of myocarditis related to COVID are from the COVID disease and not from the vaccine. So vaccinating teen boys, who are the highest risk group, is actually protective against myocarditis. And then, as Dr. Epstein said, there are things you can do about the timing of the vaccine to lower that risk even further. But vaccination is still recommended to protect against myocarditis, and it is an extremely rare complication across the board.
Great. There's another question about the bivalent booster. And who should get the bivalent booster and why? I don't know if Dr. Epstein, if you want to answer that one.
It's a great question. The CDC does recommend it for everyone ages 6 months and older now. You may see different experts with differing opinions on this, especially if you're a young, healthy person. Recommendations have gotten so confusing with so many vaccines that it's never a bad idea to talk to your child's doctor to decide what's the best fit in terms of, after that third dose, how many doses, if they should get that bivalent booster. But it is safe and available for anyone over the age of 6 months now.
Great. And I think there's another question that's asking if we could just, and you can send that to me, Dr. Epstein, and we can get the data behind the figures about the prevention of hospitalizations and also the information about the boosters as well. We can send that out to everyone that registered. So we will get that to you. Okay, that question. I see Miss Sharon Golding, thank you for this question. The attendance policy is that students need a doctor's note for absences of 3 consecutive days or more. But with the prevalence of these viruses, there are many situations where it's not necessary to take a child to the doctor, and keeping them home saves exposure for themselves and others, as well as copay for office visits. Has there been consideration to excuse absences in these cases? So thank you so much for that question, Sharon Golding. I think you're 100% right about, especially with the copays, and it does take effort to find time to take your child to the doctor after that period. That's something that I will look in with others, our attendance office as well, to see kind of what we can do around that, to make sure that kids are not getting absences for illness. But no promises on that, but it's something that we will take into consideration. Okay, this is a great question. And we can take this, I think Dr. Epstein or Dana or also Dr. Lockwood. Why are we calling this a tridemic when we didn't declare previous flu cold seasons as pandemic? Should I be worried? I don't know if you want to take that, Dr. Epstein. Why is this, how is this different? I think that's the question. How is this different from what we've seen in prior years, especially around RSV and flu?
Shara, I can take this, the first stab of it. Yeah, we are, I think I'd like to think of it as a return of cold and flu season. We had very quiet seasons recently. This is a different year in that we're seeing earlier, the increases starting earlier and at a larger magnitude. Will this continue in subsequent seasons, will it continue through the duration of the season? Will we have 2 peaks of flu? It is yet to be seen. I do think we're going to see hopefully in the future kind of a return to what we've seen in the past. And COVID has thrown a curveball, but there is the potential that we could start seeing COVID just folded into the mix. So I think we're just having again, from having a couple years of very quiet seasons, having these early season with lots of cases, but is this something we're going to continue to see year to year? I can't say for sure, and it may just be that we're having just this year is a really severe cold and flu season, but next year, we'll be returning to seeing closer to what we've seen in the past. I don't know if Shara, you have any other thoughts? I do think a lot of it is also, our hospitals are really strained right now, and the media has really taken hold of that. But again, I just think we're having a more severe cold and flu season. Is this going to continue subsequently next year? Is to be seen, and there is a good chance that we may just return to what we were seeing previously with COVID in the mix.
Thank you. Other question is, Eva Baker, my child's classroom was asked to wear masks this week. What guidelines is the school district following that will require masking? The masking, as mentioned, is especially for, I think, your classroom, was most likely based on a COVID exposure, and you should have received a letter documenting that information. So if you didn't receive that information about why your child had to mask, please let me put that in the chat so I can follow up on that. Thank you. I see that there are also questions around. So questions around the efficacy of masking only at schools when masking isn't necessary outside of schools. Are we sending the message that only public school kids are, are vectors of disease? And I will say that this is guidance from our health department around when to mask in schools. And my understanding is that other schools potentially within the city are also following similar guidance as well. Our goal is to decrease the spread of COVID-19 in the schools while students are in schools for their 6 to 6 hours. And also to make sure that our staff are protected as well so that we can preserve in-person learning and not have kids out sick. So that, and also staff as well. So that's our goal. Miss Ashley Thomas mentioned, would you like to show them how to find the CDC risk of transmission map? So I dropped the CDC community level map in the chat. The risk of transmission map, it is tricky to find and I cannot easily get that. So Ashley Thomas, would have to do some digging to find that myself. I know it is on CDC's website. I believe if you go to the link that I put in the chat, if you look across the bar, the top bar of CDC's website, it has a hyperlink to the CDC risk of transmission map, since I think hospitals are still using this to make some decisions. So I think from that hyperlink, you can find it. I see that there's a question, anonymous, about the designated eating area in the school. Can you please reach out to the COVID response team about that and we can follow up? Currently, for students that are diagnosed with the cold or the flu, there is no guidance around isolating because they should be staying home until they are feeling better, and then they can return to school once they are feeling better and or they have that doctor's note. Thank you. I see that there is a question about when the school nurse is out or unable to administer medication. If you could, Adrienne Hine, please email me, kmcdowell@philasd.org. We can follow up on that and I can give you an answer. And I know it is 6:23 and we have gone over. Time. I will drop in the link, the testing link as well. We will do that. I see the last thing I do want to put on, because I think this is very important for our students that have complex medical conditions or just students that are unable to mask for whatever reason. We do have accommodations for those students, and even a face shield is one accommodation. Frequent mask breaks is another accommodation. Or if the student is unable to mask at all, we do provide a serial testing for those students so that we can make sure that they can stay in the classroom, make sure that they are not testing positive for COVID. So there are accommodations if you do have a child that has that need and cannot mask at all. We want to work to make sure that student can stay in school and get that in-person learning if possible. So there is it's a modified test to stay accommodation that's available. Elizabeth Rothwell, let me see, sorry. I'm trying to find your, okay, this is the question about the air purifiers. I think this it is a very important question. So the question was, even with purifiers, many of our classrooms still have substandard ventilation. Given that improved air quality in our schools would help to prevent the spread of, of any of these respiratory viruses, why hasn't the school district done more to improve ventilation in our school buildings? So I can say from my office of student health services, We have been working with operations, with facilities to see how we can utilize, to see how we can improve ventilation and just air purifiers in the classroom and school setting. I know that this is something that the school district is working on, but I do, I will say, you know, ventilation is extremely important. It is something that we are working on as a school district, and I know it is a priority. Okay, so there's not, the purifiers are not sufficient enough. That's what, thank you. Thank you for that information, Rothwell, Ms. Rothwell. Okay, great. So it is 6:26, and I know that we are over time, but I appreciate everyone for staying on. Once we have the recording ready, we will post it on our Student Health Services website along with the slides once those are ready as well. And I think everyone got my email, so please reach out. I will try to respond. Any questions, you can also reach out to the COVID response team, and that will get back to myself as well. And I just am very appreciative for everyone that stayed on for this time period. Also, thank you again to our partners at the Philadelphia Department of Public Health, Dana Perella, and also Dr. Shara Epstein, and to our interpreters. And then also thank you to Dr. Katie Lockwood from CHOP for participating. Have a great day. Bye.